Hello. Thank you so much for joining us for Unite for Sight's webinar about careers in global health, thinking outside of the box. We're thrilled to have all of you with us here today. My name is Jennifer Staple-Clark, and I'm founder and chief executive officer of Unite for Sight. I will start by briefly introducing you to Unite for Sight, review the webinar logistics, and then we will hear from our 5 expert panelists. Unite for Sight is a global health nonprofit organization that promotes high-quality care for all. And we offer extensive global health and social entrepreneurship education programs. Our Global Health University program offers a free webinar series, including today's webinar, and we additionally offer 20 online certificate programs for students and professionals. Many students receive academic credit for completion of the certificates, for example, and professionals often pursue the certificates for professional development. And the certificate topics range from a certificate in global health and a certificate in global health research to a certificate in cultural competency, among 17 other online certificate programs as well. And we are really constantly working to develop additional webinars, and we will definitely be having more upcoming webinars during the fall and upcoming spring. And we encourage you to stay updated and register for these free upcoming webinars and also access past webinars at uniteforsight.org/webinars. Additional educational opportunities for students and professionals includes participation in Unite for Sight's annual Global Health and Innovation conferences and events. So our 15th annual Global Health and Innovation Conference, which is the world's largest global health and social entrepreneurship conference, will be on April 14th and 15th, 2018 at Yale University. The conference includes 300 speakers and more than 2,000 participants for a weekend exchange of ideas across all disciplines of global health, international development, and social entrepreneurship. And the conference website and registration can be seen at uniteforsight.org/conference. And Unite for Sight additionally has healthcare delivery programs, and these programs work to provide care for patients living in extreme poverty. And we partner with phenomenal local eye clinics in Ghana, Honduras, and India to provide quality eye care to patients who are otherwise unable to access or afford care. And these programs are locally led and managed by local medical professionals. And our collaboration has provided eye care to more than 2 million people by local doctors during the past decade, including nearly 100,000 sight-restoring surgeries by local ophthalmologists. Unite for Sight is the world's only organization that is both a healthcare delivery organization and that also offers immersive global health education and social entrepreneurship opportunities for students and professionals. Participants support and learn from the local doctors in Ghana, Honduras, and India as they provide care to patients living in extreme poverty in villages, slums, and refugee camps. And the participants learn from the local medical professionals about patient barriers to care and about effective strategies to reach the hardest to reach patients who are otherwise unable to access or afford care. And the local doctors are incredible social entrepreneurs who design effective and innovative strategies to eliminate patient barriers to care. Now I will describe the basic logistics of this webinar. We're so delighted to have all of you with us here today. We have nearly 2,000 people registered to attend today's webinar, and we have 5 amazing panelists, and they have a wealth of expertise to share with you during this next hour. Each of our panelists today will start by giving a 2-minute introduction about themselves, their current role, and their key guidance and advice about thinking outside of the box for a career in global health. And then we will dedicate the remaining time to your questions and answers. We received stellar questions already from you, our audience, by Tuesday's question submission deadline, and we selected the most common and most thoughtful questions to ask our panelists, and we also invite you to submit additional questions in the text box on the left of your webinar screen, and then we'll select those additional questions to ask the panelists today as well. And we also encourage you to tweet about today's webinar, including your key lessons learned, by using the hashtag GHUWebinar, and you can see that hashtag in the webinar visuals on your screen. Now we will proceed with having each of our panelists introduce themselves in alphabetical order. I'm delighted to introduce you to our first panelist, Sam Daley Harris. Sam, please begin by introducing yourself, your background and current role, and please share your key guidance about thinking outside of the box for a career in global health.
Thanks, Jennifer. I've had a crazy career path. My degrees are in music, and I founded the Anti-Poverty Lobby Results 37 years ago. Now I coach nonprofits in helping their members create champions in Congress and the media for their cause. The careers that I'm proposing are not just in policy work, but also grassroots organizing and empowerment. Let me tell you how I got here. A good friend died around the time of high school graduation, and Robert Kennedy was assassinated at the time of college graduation. This got me to start asking the purpose questions. Why am I here? What am I here to do? In 1977, I was invited to a presentation on ending world hunger, and I went thinking there were no solutions. What did I know? I was a musician. I realized that I didn't really feel hopeless about the lack of solutions. I was hopeless about human nature, people. We just never get around to doing the things that could be done. But there was one human nature I had some control over, my own, and my questions. Why am I here? What am I here to do? So in 1978 and 79, I spoke to 7,000 high school students on ending world hunger and read quotes calling for the political will to end hunger. So I asked 7,000 high school students, what's the name of your member of Congress? Fewer than 3% could answer correctly, and results grew out of the gap between the calls for the political will to end hunger on the one hand and the lack of basic information on who represented us on the other. When we first started to lobby on child survival in 1984, the global child death rate was 41,000 child deaths a day. Now it's 16,000 child deaths a day. So the jobs I'm proposing are in policy, but especially in grassroots empowerment, something that's not done very well. Groups like Results, One, Global Citizen Care, Save the Children, and others are trying to organize and empower their members. You can learn these skills now by joining a local chapter of a group like Results or even Citizens Climate Lobby to get the skills and experiences that few people have. Thanks.
Thank you so much, Sam. And Rebecca, please also introduce yourself, your background and current role, and your key guidance about thinking outside of the box for a career in global health.
Thank you, Jennifer. Can everyone hear me okay? I hope so. I am currently, you can, okay, good. I'm currently an associate professor at the University of Michigan here in Ann Arbor, Michigan, and I have recently built and coordinated a track for study of environmental justice in the School for Environment and Sustainability here at the University of Michigan. I also am working actively as a researcher and advocate for communities in Africa, building out networks at my university level, such as the STEM Africa Collaborative, which is about science, tech, engineering, and math in African countries and sites, thinking about improving African capacities in scientific and biomedical fields for independent research and for partnerships with global researchers to solve pressing problems that both drive and result from health challenges. So those are two of the hats I wear here. I was trained, however, and I want to thank Sam for a great start to this webinar, thinking, really from the sidelines of really big global problems to step in and make a difference. I was trained in cultural and social anthropology at Yale University. I came to anthropology because when I completed my undergraduate training in media and literature studies, sort of storytelling and symbols, I went into the Peace Corps in Africa, and I served for 3 years in the Central African Republic. As many of you may know, the Central African Republic is a place that is extremely impoverished at one level, but very wealthy in other ways. It is wealthy in wildlife. It is wealthy in water. It is wealthy in arable land and mineral resources. That makes it a place that is coveted by some of its neighbors and global entities that are seeking resources, and that's been a terrible story there. So when I was a Peace Corps volunteer, I was looking for a way to come back to school for graduate education that would enable me to have a connection back to the field communities who had taught me so much in the Central African Republic. In many ways, my 3 years of service as a volunteer there were the complement to my 4 years of undergraduate education in making me a person who was capable of acting in the world in meaningful ways. So I chose anthropology and completed a PhD looking at the politics of biodiversity conservation as they relate to health challenges for people who depend on bushmeat and wild forest products for the nutrition of their families. Today, I still work on those issues and on wildlife-human conflict around the African continent, but I am also building next-generation curricular tools case studies, and other virtual and face-to-face learning tools to help a next generation of environmental managers and global health experts work together on improving environmental health for all.
Terrific. Thank you so much, Rebecca. And Eve Heyn, if you can also please introduce yourself and share your key guidance.
Yes, greetings, everyone. I'm a communications professional specializing in public health, and I, like Sam and like Rebecca, didn't start out in global health. I wasn't a musician or an anthropologist. I began my career as a journalist, working for mainstream magazines, newspapers, and outlets for a number of years. And then I had a family and decided to give consulting a go for a bit as a communications consulting, applying my journalistic skills of writing and editing and storytelling. And an early client that fell into my lap, in fact, I might even say my first non-journalistic client or a client that wasn't a magazine, was a major pharmaceutical company that you all know that does a lot of work in corporate social responsibility in global health. And they wanted a storyteller for their website, their communications, and their conference communications and so forth. And while that fell into my lap because I had the right journalistic skills that they were looking for, that focus on health and global health soon led to another client in health, and then another, and then another. 10 years later, I'm a communications director who for 10 years has been focusing and specializing in global health. And that includes both as a consultant for NGOs, foundations, and companies, but also many of these years on staff with global health organizations as communications director, including a Gates, very recently a Gates-funded program in maternal, newborn, and child health. And now I'm doing something a little different. I am a managing editor at New York City's largest hospital. It's called York-Presbyterian. It includes Columbia University and Weill Cornell, but I'm still doing the same thing, which is I'm telling amazing stories about health. And now it's more of a U.S. health focus, but I'm, layering that on to global health. So I'm getting sort of a 364 full circle view, and then continuing to grow. So I do have a piece of advice, actually, that came from someone here that really struck a chord with me, given my experience, which is take the long view about your career and all the different skills and experiences you can get. Don't get stuck in, I have a job right now doing this, and this is all that I will do in my life, or I must continue this exact direction. Each step of this journey brings something and adds to your lifelong learning and career. So take a longer, bigger view.
Wonderful. Thank you so much, Eve. And James Nardella, if you can also please introduce yourself and share your key guidance.
Thank you, Jennifer. Good to be with everyone who's listening today. So I am James Nardella. I'm currently a principal at the Skoll Foundation. And here at the foundation, we work to address some of the world's most pressing social problems by investing in connecting and celebrating social entrepreneurs and other innovators who are driving large-scale systems change. So in that capacity, my role now is to investigate organizations for their fit with the Skoll Award for Social Entrepreneurship, which is a global award, and then to recommend whether we would take those organizations in as awardees at the foundation. And I work directly with our active portfolio of awardees. We've now given the award to more than 100 organizations in the last 15 years. And my portfolio includes global health organizations like Living Goods and Last Mile Health but there are other global health organizations like Partners in Health and Medic Mobile and Vision Spring and Village Reach, which are a part of the overall portfolio here at Skoll. My background, like other people on this call, is not traditional. I have an undergraduate Bachelor's of Fine Arts in theater and worked as a professional artist in the theater for 8 years in New York City, and then made a career switch in my 30s, went back to graduate school, and ended up being the early executive director during the launch and growth phase of a global health organization called the Nigella Community Alliance, which is a health and development organization in Western Kenya that is affiliated with Vanderbilt University and the Vanderbilt Institute for Global Health. And we ran a rural hospital and surrounding community health effort that reached 5,000 families in the region. It was a region known for having the highest rates of HIV in the country, triple the national average, and very high rates of under 5 mortality, double the national average. And I grew that organization from the time that it had a budget of, say, $100,000 a year to being a $2 million organization with 76 full-time staff and an annual reach of 35,000 individuals. And in my role here at Skoll and my role in launching and leading the Nigella Community Alliance, I've served as a hiring manager throughout both of those processes. So my learning as a hiring manager and in giving advice to graduate students at Vanderbilt while our offices were there is that the two most, or maybe I should say 3 most important pieces of advice that I have to give are, practically speaking, if you want to build a career in global health, you first need to apprentice with the problem. So get close to the problem, find a way to have a long-term proximal experience in the field where you live and work in proximity to the problem. For my own career shift, I went and worked for a portion of time in southwest Kenya, helping to start a new secondary school, mostly on a volunteer sort of stipended basis. And that really got me close to some of the systems and issues that were relevant to East Africa. My second point of advice is to get a graduate degree. And I think you can do those in either order. I would suggest that getting proximal to the problem could be a first order, and that you can use that proximity to inform your graduate studies. And there are a number of graduate degrees which are applicable, but obviously a master's in public health or public policy, in my experience, are really relevant to the field. But there are other masters in business administration or things that are more pertinent to leading. And then the third point of advice is to develop distinct skills. I think you heard Eve talking about her communication skills. I think from my experience in the theater, I realized that the ability to be a very good storyteller about who the organization is, where we're heading, why it matters, and to tell that story both internally and externally to stakeholders at an organization and externally to those who might support the organization was a really relevant skill set. And if I could use that in a global health setting, I could build a career on that. But perhaps building skills in program design or monitoring and evaluation or in communications or in raising resources. And those are distinct skill sets so that the body of your resume is telling a story about the way that you've gotten to know a problem, about the academic experience you have relative to that problem, and the distinct skills that you've gained to be able to address those problems.
Excellent. Thank you so much, James. And our fifth panelist, Daniel Palazuelos, if you can please introduce yourself as well and share your key advice.
Thank you so much, and what an honor to be on this panel. And listening to all these stories, it makes me wish that I had 4 more lifetimes to follow the advice that my colleagues here are giving. My name is Dan Palazuelos. I'm a physician. I call myself a global health implementer and educator. I hold a variety of roles in a partnership that Brigham and Women's Hospital, Partners in Health, and Harvard Medical School have, but I really channel my energies towards two main trains of activity. One is global health implementation. I work with Partners in Health to found and launch and help grow the Partners in Health project in Chiapas, Mexico. I also help Partners in Health represent our values and experiences in community health multinationally. And I've worked with groups like the UN and others to that effect. In terms of education, though, and this is a part that I'm passionate about, is I work as the assistant director for the Doris and Howard Hiatt residency program in global health equity at the Brigham. It's one of the few full residencies in global health. And it was created to create the next leaders, physician leaders in particular for global health equity, people who would focus on creating greater access and outcomes for the poorest populations on the planet. I also work in Harvard Medical School and have the honor to work with young students as they start to consider how they can adapt their careers and aspirations to a career in global health. So when a lot of students come to me and ask me, how can I have a career in global health? My advice is somewhat outside of the box. And mind you, this advice is for young physicians, but I think it probably does make sense for people in other fields, and I think it holds resonance with what some of the panelists have already said. The first is that it doesn't entirely matter what training program you do, if it's an Ivy League training program or some other training program. Getting trained is important, but the biggest determinant for a career in global health that I have seen, and this is, mind you, when I say this, I say work abroad, doing substantive activity to further the goals of health equity. Really, the biggest determinant is what happens in your own life. So can you accommodate your life to the salary that you'll probably get in global health? Can you accommodate your family and the aspirations of your family to the challenges, the logistical challenges of a career in global health abroad? We work with a lot of trainees. We invest a ton in them, and then ultimately we watch how they do in the outside world. And the biggest determinant of people leading global health, after we invested all of the training and support and mentorship, is usually what one would call perhaps non-professional aspects, what happens in their life. Their partner says, hey, listen, this job is too hard. You're always traveling. It's either me or the job. Or there's challenges with familial responsibilities, or a child gets sick. So that's the first thing. I say, can you align your life to the challenges of a career in global health? Then the second piece of advice is simply what Woody Allen said about success. 90% of success is showing up. And I think this holds resonance with what James was saying about apprentice with the problem. And I love that phrase. If you go to a project, you go to a country, a context, you stick with it. You have passion and perseverance for long-term goals in that context and with that problem. Over time, you will find success. You will find a lot of challenges, but you'll stay in it. And then ultimately, when it's all said and done, you'll say, wow, I was able to really do something. It was substantive, it was sustained and sustainable, and I think you'll be proud.
Wonderful. Thank you so much, Daniel. And as you heard, all of our panelists have a wealth of expertise and such varied backgrounds and interests and so much guidance to share with you today. Now we will proceed with the question and answer session. As mentioned, we received questions in advance from you, our audience members. And if you have additional questions, please post them in the text box on the left of your webinar screen. And our first question is for Rebecca. If one wants to have a career in the field of global health, what is your advice for undergraduates in terms of classes to take, internships, jobs, or volunteer positions, mindset to have, et cetera?
Thanks, Jennifer. And I appreciate the question coming to one of us who is, in fact, spending a significant amount of time with undergraduates and teaching undergraduates. I experience every year more and more anxiety among my students about the relationship between the time they're spending in class and how that's going to assist them in navigating complicated career paths and opportunities. And it really is quite difficult. I think that there are some key competencies, if you want, for careers in global health, and they're very similar to the ones that we are defining for work in sustainability and environment. They include skills at collaborative work, skills at integrating thinking and ideas from different knowledge traditions, like being able to think integratively across knowledge fields. Something like what I was trained in, anthropology, has clear relationships to something like epidemiology, but you have to get some experience spelling that out to understand, which elements of anthropological work can relate to or improve epidemiological study. So I would say, if you are finding yourself in coursework and or summer work in a quandary, think about what core competencies you want to attain. As I suggested, collaboration, integrative thinking. I would say also that intercultural communication increasingly is a really important skill. And I don't mean learning Mandarin or Arabic or Italian. I'm talking also about thinking across different identity groups. And that's more and more important right here on our own campuses in the U.S., as well as when we travel within the U.S. or abroad, right? Any situation you find yourself in probably is a situation that is marked by cultural differences among the different people in the room. So figuring out how to think about that and be attuned to that and aware of that is such an important skill for global health and many other fields today. I would say also that this theme we're hearing so much about from my fellow panelists, storytelling. Do not underestimate the range of ways in which something like a writing course or a filmmaking course or theater, right, which we heard about, can be a crucial professional skill in ways that your parents probably would never believe. Mine didn't. I know I did an enormous amount of theater as an undergraduate, and it has been one of the things that has been so helpful to me not to feel nervous when I step in front of a lecture hall or an audience. So bear in mind that the ultimate guide of what is useful to you, is the way that you are going to put these pieces together and leverage what you've learned about presentation, collaboration, integrative thinking, intercultural communication, as well as the more formal analytics and building blocks of science or policy or economy or wherever you find your interest moving. Don't forget that you're developing yourself as a whole professional. And the final thing I would say about that is that in any undergraduate trajectory, you have to balance your search for underlying competencies that will help you navigate a changing world. You guys are the generation who may have multiple careers. Certainly you'll have multiple jobs. What are the skills you need to be able to navigate and adapt, in fact, your skills base as economies change around you? So you're building competencies as well as knowledge. And if you find professors or teachers or team leaders or group project leaders that you think really get you and can help you, do not decide against that opportunity only because it doesn't seem entirely relevant to global health, because it might well be that those relationships could be very, very important moving forward. I think it's a balancing act, but I would say that being, mindful of your underlying competencies and skills, your human relationships of learning, as well as the basic knowledge like economics or policy or epidemiology, that's the balancing act you have to sort of respect for yourself and pull people into advising you on.
Excellent. Thank you so much, Rebecca. And James, the next question is for you. I've been struggling to find a job in the global health field as a recent graduate that is full-time and paid. Would you suggest doing unpaid fellowships and internships first? How likely are those to turn into full-time positions?
If I revert back to the initial advice that I talked about, which was get proximity or apprentice with a problem, and make sure that you have a graduate degree that is applicable to the field. It seems like that's an entry point. I think about the hiring bar in most of the job postings that I've put out or the organizations that I've worked with have put out. And so if there's a way to find a way to take a fellowship or a low-paid internship that would allow you to do that. I think that that's a good step. I'm familiar with, for instance, the fellowships at Global Health Corps, or the one that you offer at Unite Foresight or Princeton in Africa, or even the Peace Corps opportunities. And though these are low-paying and competitive to get into, they're looked at with a lot of integrity on your resume. And so I do think that those kinds of experiences are important. I just hired someone here as an analyst at the foundation who had come out of a Global Health Corps experience, and that was distinctly an advantage during the application process. In the past, I've hired people who have come out of Princeton in Africa and worked for us at La Walla. And so I think those fellowships, I think if you look at the data coming out of Global Health Corps, for instance, I know that a large percent of their fellows go on to have jobs at the organizations where they are posted. And so that would be a good sign. And more than 95% of their fellows go on to have continued careers in global health or social justice fields. I'm sure similar statistics exist for Unite Foresight in Princeton in Africa and Peace Corps.
Terrific. Thank you so much, James. And Sam, what do you consider some of the most highly desirable skills to have in the global health job market?
Okay, thanks. I'm going to still stick with my grassroots organizing and empowerment focus, but these could still be relevant elsewhere. To start and empower groups, you have to be entrepreneurial. To start and empower groups, you have to speak powerfully. And perhaps the biggest thing is to have a vision and be pulled by the vision rather than stopped by the fear of rejection, the fear that the volunteer you're talking to will say no. I was talking with someone today and she said, I just don't want to annoy people. And I said, well, you're not annoying people. You're offering them a gift. Your goal is to feed them power. They might not be ready to be fed power. They might not be ready to accept the gift. That's fine. Just move on. So being entrepreneurial, being a powerful speaker, and being pulled by a vision are some of the most highly desirable skills in being a staff member organizing grassroots action on global health.
Fantastic. Thank you so much, Sam. And Daniel, do you think the supply of candidates is larger than the demand in public health professionals during the hiring process, and how do you make yourself stand out?
That's a good question. I think the person that asked that is appropriately worried that they're spending so much time working towards getting a degree, and they're going to go out and they're going to look like a million other candidates, and they're never going to have a job and have to settle for something that they don't quite want to do. They won't be able to follow their passion. I would say, flip that on its head a little bit. And if we say, is the supply of potential candidates too great compared to the current available positions? Maybe. But are we focusing enough on, is the supply adequate to actually address the problems that our world faces? And I would say definitely no. I think that what this generation and generations to come, and I hope my generation and generations before me have done a little part of, is trying to move the bar on what is possible to make the world a more just and equitable place. And I would say for students, when they're trying to think about their place, don't be limited by whether or not there's as many job opportunities as you are anticipating. Instead, be liberated by the magnitude of what needs to get done. Consider yourself as part of a movement, but at the same time, even though you're part of this profound tidal change of understanding and activity, you're also, as has been said on this panel, an entrepreneur. There's a lot of stuff that you and your individual creativity and ability to design and your own passion and perseverance can actually contribute to this field. So look for the jobs, try to get the best job that you can, stay passionate for the issues that job is tackling, but then also when you hit a down point and you're thinking that maybe you're just better off going back to your hometown and working in finance or whatever their job, that's a perfectly good job, but maybe not what you were anticipating, just say, what else can I potentially do to be a part of the solutions that I want to see in the world?
Terrific. Thank you so much, Daniel. And Eve, how do you incorporate unique skill sets into a global health position, and how do you ensure that prospective employers appreciate skills which may be outside of the box?
My advice would be to develop your niche, your expertise, and whatever that skill set or expertise is, it can be applied to global health. So you develop your skill set, your expertise, and you layer onto that the global health subject. And it doesn't matter what you do as long as you're good at it. Global health needs a wide range of skills. So, yes, some obvious paths to global health are people with research backgrounds, physicians, epidemiologists. However, we need accountants. We do need that finance person. We need the tech gal. We need the photographer. And we need, as Rebecca mentioned, the theater major. I actually have a colleague who is a theater director, and for the last few years, she's been working in Kenya's largest refugee camp, directing theater, and she loves it, and she is playing an extremely vital role in the refugee camp with children there, and, long time people have just lived there for years and years and years, their whole lives, really. So I feel one thing I love about global health is that it isn't so straight and narrow. It just requires so many different types of professionals and skills. And if you really have something, a niche that's unique, and you love global health, I believe you will bring value to an organization. And, so the person who gets despondent and goes back home and studies finance, if she actually develops that into a career, come back to global health. There will be a job for you.
Great. Thank you so much, Eve. And our next question is for Sam. Is it best to gather experience in a specialized field of global health, like nutrition, or get involved with various different ones, such as infectious diseases, gender rights, nutrition?
Okay. So, of course, I see the answer is both. You do want to have depth in a specialized field, but experiences in different specialties are important too. But for fear of being a Johnny One-Note, I'm going to go back to my out-of-the-box staff-level grassroots empowerment focus and ask questions like, how many on this call have met with their member of Congress? President Trump proposed cutting the foreign assistance budget by almost 30%. That includes cutting the global health programs by almost 30%. For now, Congress is stopping many of those cuts. In 1986, after the results volunteers generated 90 editorials in a successful campaign to triple the Child Survival Fund, Jim Grant, the head of UNICEF, sent us a handwritten note saying, quote, I thank you in my mind weekly, if not more often, for what you and your colleagues are accomplishing. And he was talking to volunteers, really. So get skills in placing an op-ed, in meeting with a member of Congress, in empowering a local team, and you'll be ahead of the game for sure. And you can get those skills by volunteering with an organization that's really feeding power to their grassroots groups, and you can do that right now. Some of the best power feeders include Results and Citizens Climate Lobby. And we don't have to be very wide awake to know that these kinds of voices are desperately needed today.
Wonderful. Thank you so much, Sam. And a question for Rebecca. This is one just coming in from the audience. Is a different language a requirement for a career in public health? Is knowing another language important?
Thanks, Jennifer, and thanks to our audience. I'm an anthropologist by training, and so I love to make languages a requirement. I feel like we should all be doing better on that in this country, in part because languages are ways of thinking and seeing the world as well as just, skills for communicating. The truth of the matter is right now that the technologies available to us for translation of our work are getting better and better. Voice recognition is getting better and better. I would say yes, but with the caveat. So my answer to your question is yes, absolutely, but with this caveat. Think about the language requirement not only as mastery of a foreign language of some kind, Spanish, or in my case, Bantu languages. I mean, I speak 2 different languages from the Central African Republic very fluently, and let me tell you, it doesn't help me with anything much except for being in the Central African Republic and occasionally translating for people seeking asylum. But it helped me develop a way of thinking and a more empathetic and cognitively differentiated view of the body and health, and that was wonderful. So when you think about your language requirement, I don't think you should narrow yourself only to a foreign language. You could think about it, and we often do in higher education now, as a coding opportunity or a computer language, anything that moves you away from your normal way of thinking about a problem into a new way of communicating about it. It could be sign language. It could be, I really think thinking broadly about a language requirement as an intercultural or intertechnological communication requirement is sort of where things are moving. And so I would be sure I check that on my competencies box, but I don't think you necessarily have to have finishing school style French and be able to pronounce the name of every canapé on the cocktail tray to be successful. It's more about teaching yourself to think in those ways and identify translators and technologies for translation that you can trust. Begin to learn who to go to figure out if the way you're translating something makes sense to people who speak that language in a vernacular way. And that may be as important as actually mastering a single foreign language or even multiple foreign languages. Thanks.
Excellent, Rebecca. Thank you so much. And Daniel, what are your suggestions about career development for public health graduate students who have no prior public health working experience?
Good question. I would say get global health working experience. I know that sounds straightforward and simple, but, as some of the other panelists have said, this idea of being able to be close to the problems and seeing it firsthand is paramount. In addition, there are opportunities to do that. Ideally, you're leaving graduate school, you have loans, you have to pay for them. You would want to get paid. If you have the capacity to do something for free, that often, if you do a good job, often that will pivot to getting a job inside an organization. I mean, I know in Partners in Health, some people who now run country projects started off as administrative assistants because they were simply excellent. That's even a policy that I've seen Partners in Health utilize for running entire community health worker programs on site. And I remember in one program in Lesotho, the clinic security guard ultimately became leadership in the project because he was just excellent. You could see with your own 2 eyes. One of the things that's really interesting about a lot of nonprofits that are really strapped for cash and are trying very hard to use every last dollar that they have for social good is that they don't have a ton of time and money to have these very extensive hiring processes. They don't, to vet all of the sources and to have these extensive interviews. So a lot of times they'll get a grant and they'll have a hiring process, but if they already know you, you're on site, they've seen you work, they know that they like working with you, if you're a good person, you're not crazy, that type of stuff, then they'll say, well, give it to them. They're here. And that all starts only by, as I said before, Woody Allen said, 90% of success is showing up.
Terrific. Thank you so much, Daniel. And actually, another question for you, Daniel. For those interested in program development and global health implementation, do you think that not having a medical degree is a disadvantage?
No, definitely not. I mean, in some ways, having a medical degree is a disadvantage. So that's your grandmother who wants you to go to medical school. It's hard to say. I mean, medical school is, one, very expensive, so you often leave with a lot of loans. Two, a lot of times you get on a train, especially in the United States, where you have this very intensive pre-med process and this very intensive medical school process and this harrowing residency process. You leave and a lot of physicians just say, I just want to get reimbursed and have my house in the suburbs and call it a day, So at the same time, though, being a physician, having a reimbursable skill actually does open up incredible avenues for doing this very interesting cross-pollination of activities. So, this thing called the full-time equivalency. And I think this is true in other professions too, but this idea that you can chop up pieces of your clinical work to then make room for other parts of your work, what, sometimes in medicine we call the systole of your work and the diastole of your work. For all the medical people out there, that's kind of a nerdy internal joke. But, the systole would be where you work clinically for 25 to 75% of your time. I myself am a global health hospitalist. I work at the Brigham as a clinician, and that actually makes 60% of my salary. But that buys a huge amount of time that I can work with Partners in Health, with Harvard Medical School, with PIH Mexico. If I want to, I can pro bono a big chunk of my time because I've sort of met the needs of my life and of my family. So the medical degree has its pros and cons. And my advice to people is do what you love. If you really love the human body and clinical medicine and that clinical moment, from what you see of your own experiences with the system, then go for it. But if you don't do it just because you think it's the avenue in. It costs too much. It's too complicated. Instead, train to the highest level possible. Try to get a degree that allows you the best possible reimbursement, and then just take a big chunk of your time and donate it to something. That is a great recipe for just having the time and energy and space to do something really important in global health. Thank you.
That's wonderful. Thank you, Daniel. And our next question is for Eve. How can someone who has not had much experience working internationally get into global health? How does one share with employers that they could be a good candidate for a global health position despite their limited experience?
Sure. Thank you, Jennifer. And thanks to everyone listening in. It's certainly helpful to have that experience, but it shouldn't be an impediment in most cases to finding a job. First of all, just to backtrack, you could volunteer for Unite for Sight, whose programs are just wonderful, I'm told, from several people who've participated in them, and then, of course, there are the fellowships. But that does require time, and it can require costs on your part. But if you can take some time to travel, even if this is not for a job, it does help to see the problems up close and to have that experience. It will inform you, and I think employers would like to see that. So I know of a young woman, a recent college grad, young journalist who was working a day job, working at a magazine, writing global health stories by night, and she used her vacation time to travel to Africa and wrote a series of really groundbreaking, unique stories on malaria. that are really helping her in her career. I had never lived in a developing country, and I didn't find it to be a problem in my line of work, but I brought, as we discussed before, values, skills, and a real knowledge and subject expertise of global health that I developed over the years, and passion, which is extremely important. And I did ultimately get that experience on the job. I was given the job, and through the job, I continued to apply my skills of storytelling, videos, of stories, of, seeing our programs in action on the job, and was over the years able to gain that. And it did very much does inform my work. But I think if you know your beat and you know your subject and you come with skills, knowledge, and passion, in most cases, but without international experience, I think in most cases it won't keep you from getting the job, that you can actually gain that on the job.
That's wonderful. Thank you, Eve. And our next question for Rebecca, how can I work in a developing country efficiently? Many students and researchers who have worked abroad found that their time and the funding that they received were not sufficiently used. Some also find that their presence in some developing countries might harm local communities because they're taking jobs from local researchers who are more qualified. How can we prevent this from happening?
Yeah, I looked at this question earlier and I thought, wow, what a smart question. It's because what the question does is it gets right to the heart of some of the inequality that characterizes the political economy of research on global health problems. And that is such a serious challenge for all of us. I have to say, in my own experience, I have realized that it's extremely important if you would like to work abroad, or indeed even within marginalized communities within your own country that may, have significant challenges relative to the community you're coming out of. You need to first have an ethics of being adequately resourced for the work you want to do. You need to make sure that you won't be in any way a drag on in-country collaborators, that you can. And that doesn't mean you have to have a ton of cash. It may be possible to broker arrangements whereby you're able to provide in-kind support to an initiative in some field where they require technical expertise, and in return they can help you with safe transport because they have a fleet of vehicles they maintain, and that's important for safety, or something of that nature. But think it through and make sure that your understanding of what constitutes a reciprocally advantageous quid pro quo is also shared by your in-country collaborators. So that means what? That means you've got to start thinking way ahead of time, if you're going it alone, about how you're going to structure that. Another important alternative to going it alone, and hence planning very early and very carefully your stay and your work in a place with which you are not familiar, is to piggyback on a reputable organization or agency. Unite for Sight is so wonderful for this in some ways, right? Matchmaking between people who would like to volunteer and organizations with something of a proven track record for welcoming and making good use of volunteers. And I think that, each of us has to ask ourselves, what's the nature of what I want to get done? Am I at an early enough point in my career where I need to be immersed and I need to be observing and absorbing knowledge, as it were, apprenticing with the problem? And if so, would I have a better opportunity for that by going it alone? Or am I at a point in my career where I can really strengthen an organization? Each of us has different answers to these questions, but asking them early and often, as you're doing here, is very important. The other things I would say are that collaborating in countries with scarce resources in ways that are meaningful with local partners. I have consistently throughout my career reached out to university students And I remember as a Fulbright researcher in the Central African Republic during my dissertation work, other Fulbrighters said to me, gosh, why are you working with these university students? Your questions are so sensitive. How can you be including other people in that work? And I remember saying to them, because I'm going to go home. And these people are going to stay here. And something I am sure will come out of the collaboration that will both make me smarter and them smarter about these common problems. And I think, there were valid points on both sides of that. There were some ways in which I had to think about what data collection or what kind of group work I needed to facilitate on my own and what work I could incorporate my student collaborators in. But I will say those relationships with those students who are now themselves professors and professionals in Central Africa have borne so much fruit over the years of goodwill of me as someone who shares resources, which is often important in economies where resources are scarce. And so I would encourage you to think about how would you structure collaborative work, how would you structure an in-country partner that would transfer some skills between the two of you, moving away from a unidirectional model whereby we hold the skills that we share, right? But really think about how would I build in collaboration that might outlive this single project and build relationships across projects over time, across distance and across cultures, because that is something that transcends a single research question or a single intervention and can make all of us smarter and stronger in addressing global health problems over time. It can also get you more bang for your buck if you do it with enough early planning and enough good communication with your in-country partners. Thanks.
Excellent. Thank you, Rebecca. And a question for James. For those interested in working at a foundation or in social enterprise on global health issues, what would you say are the most compelling skills to have?
Thank you, Jennifer. I don't know if you could put up the 2 slides that I had there. I think
sure, yes.
that one way of imagining the framing for how you might think about a career in global health or in international development is to imagine on the one end of the spectrum you have the resources, so that's represented here by a $ sign, and on the other end of the spectrum you have a beneficiary represented here by a girl child. And so thinking about whether you want to work in direct action closest to the beneficiary or if you want to work closer to the resource itself. So let me make this a little more tangible by putting in a real life issue area. So if you can go to the next slide. If we think about water and sanitation and hygiene, my past work with Lawala Community Alliance, we were directly intervening with 5,000 households working on water and sanitation and hygiene, community-led total sanitation with those households, and 13 government primary schools, setting up water and sanitation and hygiene projects there. So that's direct implementation. But you could also imagine one layer out from that is technical assistance. So, Water for People, which is one of our Skoll awardees, they are in the business of technically assisting local providers by helping them think through the monitoring evaluation for how they make sure that they cover everyone for a sustained period of time in an entire district. Then you have more sector assisting organizations. You think about What's Up, that's water and sanitation for the urban poor. They're assisting utilities in thinking about how they change their business models to affect the bottom of the pyramid customers. Or water.org that is thinking about how you use financing to water credit. So that's more like a sector assistance. One step removed, you might have policy or advocacy, like the One campaign. Another step removed, you might have a funder, like the Skoll Foundation, where I am now, or Charity Water, or a corporate funder like Coca-Cola. One step removed from that, you might have the UN with the Sustainable Development Goals, or a bilateral funder like DFID in the UK. And I think you can see, so my first experience as a leader was leading Lawala Community Alliance, which is a social entrepreneurial experience, and now I'm on the funder side. But the more important through line, the kind of framing is you can sit anywhere on the spectrum as long as you're serving the issues that you care about. So if I care about water and sanitation and hygiene, or in my case, if I care about girls' education or maternal and child health, I'm willing to sit anywhere on this spectrum as long as I have meaningful work on those issues. And I think the question for people who are coming out of training, college, or graduate school is, where do you want experiences along the spectrum? And do you want to direct your time and attention to a place on the spectrum, like I really want technical assistance experience, or I really want to work at the level of a funder? Or do you want to tie your career to some issues where you can really sort of gain expertise in WASH in this case, and you can be relatively agnostic about where you end up on the spectrum, that you would work on WASH at any level. And I think this kind of framing has been helpful in thinking through where to start. I would also just say a lot of the conversation today has reminded me that, our vocation is not just our occupation. It's who we are and how we want to live, which includes our occupation, but also includes lots of other things about our lives. So for me, it made a lot of sense to lead Lawala during my 30s. I was fresh out of graduate school. I was married, but I didn't have any children. I could travel, 100, 150 days a year and be in Kenya. Now I have 2 children. It makes a lot more sense for me to, remain close to the field, but to use that experience that I had towards the same vocational aims, but at a different spot on the spectrum as a funder. And so, vocation has this kind of ebb and flow or changes in tempo, where at times you're kind of available to be all in on your occupation, and at other times you need a different kind of balance in your life. And so I think that we should think about our vocations as being a very long story of who we are and how we want to live, and include a kind of seasonality in our thinking.
Fantastic. Thank you, James. And thank you so much to all of our phenomenal panelists and for all of the incredible guidance and expertise that you've shared with us today. This brings us to the conclusion of today's webinar, and thank you also to our audience for joining and for submitting such wonderful questions. Thank you, everyone.